everyone. I'm Dr. Anupama Chowdhry Devgan, your physiology faculty. And this is the daily quiz series in the run-up to NEETPG 2025. We are in week 4, day 6. And the topics that I'm covering in this week are renal physiology and GI tract. So let's look at these questions from these two topics. The first one says, which of the following will be the most likely cause of hypernatremia associated with a small volume of highly concentrated urine, and the urine osmolality is 1200 milliosmoles per liter? The person has normal kidneys. Is it going to be diabetes mellitus? Now, in diabetes mellitus, I expect an osmotic diuresis. There is a polyuria. Why an osmotic diuresis? Because there is loss of glucose, sodium, potassium in urine, and urine output increases. But here the question says small volume of a highly concentrated urine. So this is not the answer. In Barter's syndrome, there is a loss of function mutation of the proteins involved in sodium potassium chloride reabsorption in the thick ascending limb. And remember, the symptoms of Barter syndrome are similar to Lasix overuse. So what do we expect in a Lasix overuse? There is definitely not a hypernatremia. In fact, the opposite, hyponatremia. There is a decreased plasma concentration of most electrolytes, whether it's sodium, potassium, chloride, calcium, magnesium. The urine output increases because there is loss of more electrolytes in urine. So this is definitely not the answer. In Gitelman's syndrome, Gitelman's syndrome, there is a loss of function mutation of the proteins in the DCT. These proteins are involved in reabsorption of sodium and chloride. So this affects the DCT, and the symptoms are similar to thiazide overuse. Again, hypernatremia is not a possibility here. Plus the urine output would have increased. So again, this is not the answer. So the answer here is dehydration due to insufficient water intake and heavy exercise. Now, because of insufficient water intake, there is an increase in plasma osmolality, more secretion of ADH, and that causes the urine to become highly concentrated. So answer is D, dehydration due to insufficient water intake and heavy exercise. Let's look at the next questions. Lines A, B, and C in the figure show the relative filtrability by the glomerular filtration membrane of dextran molecules as a function of their molecular radius and charges. Which lines on the graph best describes the electrical charges on the dextrans? Now, 3 dextrans have been taken. One is neutral. The other is polycationic. That means it has got positive charges on the surface. And the third is polyanionic. That means it has negative charges on the surface. Now, when we look at these 3 types of dextrans of equal molecular radius but different charges, the filtrability changes. The reason for this is because when you look at the glomerular filtration membrane, especially the basement membrane has got a negative charge because of the presence of sialoproteins. So this negative charge of the glomerular filtration membrane, it repels negatively charged substances and attracts the positively charged substances. So if I look at 3 dextrans of same molecular radius, which one will have the highest relative filtrability? The one which has got a positive charge. Negative charge of the glomerular filtration membrane will attract the positively charged dextran. Unlike charges attract. And which one will have the least filtrability? The anionic, because like charges repel. For instance, if you look at this graph, if I take a dextran of 22 angstroms, the relative permeability of A is 0.2, of B is 0.7, and of C is almost 1. So in this case, C is polycationic, highest relative filtrability. A, which has got the least relative filtrability, will be polyanionic, and B must be neutral. So that means my answer is A, polyanionic, B, neutral, and C, polycationic. Let's look at the next question. All of the following are true about the given graph except, now this is a cystometrogram. What is a cystometrogram? We take the intravesical volume on the x-axis and the intravesical pressure in centimeters of water is given on the y-axis. As you can see over here, initially as there is an increase in the bladder volume, there is also an increase in the bladder pressure. But if you look at phase 1b, what has happened? There is increase in the bladder volume, but there is hardly any change in the intravesical pressure. And why does this happen? Because in this phase, as the bladder is getting filled with urine, it tends to expand. When it tends to expand, the intravesical pressure shows no change. This continues till the bladder volume reaches 400. At a bladder volume of 400 ml, the urge to pass urine becomes uncontrollable. So the detrusor muscle in the wall of the bladder will contract. There is a sharp increase in pressure, that is phase 2, and there is evacuation of the bladder. So is this a graph showing the change in intravesical pressure with the change in the intravesical volume? That is true. Is it a graph showing the volume-pressure relationship of the bladder, which is also true? It is known as a cystometrogram, which is true. This graph can be used to calculate the bladder volume. That is false. So answer to this becomes D. 2 points to remember. The first urge to pass urine is at a bladder volume of 150 ml and it becomes uncontrollable at a bladder volume of 400 ml. So what has happened in phase 2? Sharp increase in pressure. That is because now the bladder volume is at 400 and the individual has to evacuate the bladder. Let's have a look at the next question. Which of the following is absent in smooth muscle? Smooth muscle has the presence of actin, it has the presence of myosin, it has tropomyosin, but what is not present in smooth muscle is troponin. So which is the calcium binding protein which is present in the smooth muscle of the GI tract? That is calmodulin, a question which has been asked again and again. Now, please remember, you do not have the typical light and dark arrangements as you see in skeletal and cardiac muscle. In the case of the smooth muscle, there are something known as dense bodies which are present. Actin is attached to the dense bodies and myosin is found in between these actin filaments. So please keep in mind that the typical light and dark arrangement which you see in skeletal and cardiac muscle is not found here. That is why this is known as smooth or unstriated muscle. But yes, actin, myosin, tropomyosin are present. What is not present is troponin, and the calcium binding protein which is in place of troponin is calmodulin. Digestion of disaccharides occurs in which of the following segments of the GI tract? The mouth has the presence of the salivary amylase. Small intestine also has the pancreatic amylase. But the disaccharides will be digested by the disaccaridases, which are present in the intestinal secretion. So, answer to this question will be the small intestine. Small intestine, or the brush border enzymes, the disaccharidases such as sucrase, lactase, these will act on the disaccharides and convert them into monosaccharides. And carbohydrates will be absorbed in the form of monosaccharides: glucose, galactose, fructose.